Welcome to Foundations in Therapeutic Modalities and Thought-Focused Therapies. A general overview of our session will be examining thought-focused therapeutic modalities, types of thought-focused modalities, roles of cognitions in counseling, elements of thought-focused modalities, as well as the empirical support. What are thought-focused modalities? Well, thought-focused or cognitive modalities consider thoughts as the primary determinant of our emotions and behaviors, as well as determining our mental dysfunction or our mental health. So the focus in these approaches is on identifying distorted or dysfunctional thinking, modifying beliefs, relating to others in different ways, and ultimately to changing behavior. Cognitive therapy was conceived of back in the 1960s. Albert Ellis and Aaron Beck, both psychoanalysts, developed the first thought-focused modalities, and although different from each other, Ellis went on to develop what evolved to become rational emotive behavior therapy, or REBT, and Beck's own interest in thoughts and how people react to the way they think led him to develop cognitive therapy. Aaron Beck was very interested in the efficacy of psychoanalysis in treating depression, which led him to develop an approach that considered the most important elements in therapy are the way we think, what our thoughts tell us, and how we react to those thoughts. So essentially, Beck's model of therapy, which shares some similarities with Albert Ellis's cognitive approach, is aimed at helping clients identify their distorted thinking, modify beliefs, relate to others in different ways, and eventually change their behavior. Albert Ellis was, one might say, equally disillusioned with psychoanalysis, and his conception of a cognitive approach to therapy evolved into what is now called rational emotive behavior therapy, or REBT. Now, REBT seeks to challenge us and modify our rational beliefs, and through the process help us to learn self-acceptance. So while Ellis's REBT and Beck's cognitive therapy evolved separately and have differences, both share many commonalities, especially in terms of their theories of human development, concepts of effecting change, as well as strategies. Thought-focused therapies such as Beck's and Ellis's have been extensively researched and shown to be highly effective because thoughts are readily accessible, they're often less threatening than feelings. Thoughts are more responsive to change and analysis, and that they can be documented. Their validity and helpfulness can be determined and, when appropriate, disputed and modified. So as well, modifying or changing thoughts can be relatively quick, thus allowing for clients to experience positive movement or early in the treatment process, which can also impact their motivation and their sense of optimism. So the process of learning to identify, dispute, and consequently change our thinking can be very empowering and offer us a greater sense of control over our lives. Both Beck and Ellis's treatment approaches are phenomenological. They share aspects in common with models such as person-centered, existential, and Gestalt. Cognitive clinicians believe that the basic material of treatment is from our transient automatic thoughts and our ingrained assumptions and schemas. So therefore, the goal of therapy is to teach the client how to recognize, identify, and respond to their dysfunctional thoughts. Once identified, those dysfunctional thoughts may be replaced with more accurate, helpful, and healthier ones. So to accomplish this, clinicians will utilize, for example, inventories, assessments, and suggested tasks or homework. So we will be examining some of these strategies in a little more detail a bit later in this session. Although cognitive clinicians are directive in their approach, they still focus on common factors of a collaborative therapeutic relationship as we viewed in other modalities. So in this, the therapeutic alliance necessitates a supportive and healing environment. So the clinician understands the client and their background through a holistic lens, has a sense of the direction or goals, as well as a shared understanding with the client around the nature of the problems to be addressed, and then seeks to use valid treatment approaches to address those presenting problems. Experiments and homework, or what Beck preferred to call task assignments, are designed for clients to complete outside of sessions. So they're thought to help the client recognize their underlying thoughts and reinforce work that has occurred during sessions. So task assignments are also thought to contribute to skill building and helping the client feel empowered. But cognitive clinicians also view task assignments as needing some guidelines in order for the client and the clinician to view them as positive experiences. So next we will examine what those consist of. Whether the words homework, task assignments, or between session projects are used, the key is for the clinician to use language that will bring about a positive response from the client. So within this approach, cognitive clinicians follow some guidelines for homework. So the first is determining the tasks or project needs to be a collaboration between the client and the clinician. The tasks or assignments are connected to and they address the issues that come up in sessions. Homework tasks need to be specific, allowing the client to know exactly when and how to complete them in order to reduce any resistance or barriers to the assignment. So, for example, instead of suggesting a client have more social interactions with friends, the task might specifically involve having text or telephone conversations of at least 5 minutes with 2 friends on Friday, and inviting one out for coffee. The homework must also be fairly easy to accomplish so clients can experience success. Careful planning on the part of the clinician can facilitate increasing the difficulty of tasks through the process. The outcome is always aimed at helping the client feel empowered and optimistic about their treatment process. Cognitive clinicians also first practice homework within the session to allow the opportunity to coach and encourage the client within the session process, as well as increase the client's motivation to want to use these rehearsed skills outside of the session. Clinicians should further address any possible barriers to completing the homework and any potential negative outcomes that might interfere with the treatment process. So for example, role plays and cognitive rehearsals are useful techniques for helping a client prepare for those challenging tasks. Assignments also need to be thoughtfully planned in order to minimize the likelihood of any excuses for not completing them. And this is best accomplished through creating assignments that rely on the client as opposed to other people or external circumstances. The clinician needs to attend to the client's response to homework, so confirming that they understand the reason for the homework, and then frame it all without judgment. Assignments should also be presented with options. So, for example, presenting a client with 3 tasks and encouraging them to complete only 2 gives them a sense of control without sending the message that this is reminiscent of school days where all the work must be completed. Both the client and the clinician write down any assignments, so that's offering a reminder for appropriate follow-up in the next session. Now, overall, the homework or task assignments can be a rewarding and reinforcing experience for the client, which is, of course, the intention. What are some applications of thought-focused modalities? Well, firstly, cognitive therapy is easily replicated and it lends itself well to clinical trials and manualized treatment, which can be helpful in guiding clinicians in particular when working with someone with a specific disorder. Research also supports the use of cognitive therapy for anxiety disorders, mood disorders, personality disorders, and schizophrenia. Cognitive therapy's focus on thoughts can make therapy more acceptable for a wide range of people, and most especially those who are not used to sharing emotions, because they may view emotional expression as a sign of weakness or to be in conflict with their self-image or upbringing, such as within certain cultural, gender, and age contexts. To briefly recap our session, we have learned that cognitive therapy was developed by Aaron Beck, and rational emotive behavior therapy, or REBT, was developed by Albert Ellis. We know that cognitive therapy is an approach that allows clients to assess and modify thoughts, feelings, and their behaviors, and that homework in this model is a process of skill building, and it is vital to change in this approach to therapeutic treatment.